Hello, I am Dr. Mike Shah. I am a board certified psychiatrist in practice in Atlanta, Georgia. I want to congratulate Ms. Cass Gayuri on her latest book, Kiss Innocence Goodbye. It is a much needed and timely introduction to the topic of child abuse. The statistics on child abuse are alarming. It is estimated that thousands of children die each year due to abuse. The typical scenario is a child is abused by a parent or a family member, and at least 1 in 7 children gets abused per year. Rates of child abuse and neglect are 5 times more common in lower socioeconomic status. And it is very important to take it seriously when a child says that they have been abused and immediate action should be taken. About 28% of adults report that they have been abused physically as a child, and about 20% of adults report being sexually abused as a child. Often, the severe emotional damage to abused children does not surface until late in their adolescence or adult life. An adult who was abused has a hard time developing personal relationships. They have trouble with physical contact, closeness, touching, intimacy, and trust as an adult. Unfortunately, physical abuse is not the only kind of child abuse. There are other things like emotional abuse, neglect, and sexual abuse. About 1 in 4 girls and about 1 in 13 boys in the United States experiences sexual abuse at some point. The vast majority of sexual abuse is committed by someone a child or their family members know. And the long-term emotional and physical damage after the abuse can be devastating to the children, resulting in adulthood in conditions like depression, post-traumatic stress disorder, addiction issues, and stress related issues and suicidal behaviors later in life. That is why it is important to identify it as soon as possible and seek and provide help to prevent problems for the future. Child abuse more often takes place within the family, either by a parent, a step-parent, a sibling, a relative, a teacher, a caretaker, a babysitter, etc. And when that happens, when sexual abuse occurs within the family, the child may experience fear and anger as they may be afraid that coming out with it may cause more damage in the family relationships. Child victims of long periods of sexual abuse often develop low self-esteem, depression, poor judgment and relationships, and abnormal view of sex. They may become more withdrawn and become suicidal. Some children have been sexually abused also display abnormal sexualized behaviors, and they may sometimes become perpetrators themselves. Parents can prevent or lessen the chance of sexual abuse by teaching the children to learn to say no when they are not comfortable in any situation, whether they feel uncomfortable someone touching them. And also, they need to be told not necessarily to respect an older person all the time. Don't tell the children to always do everything the teacher or the babysitter tells you to do, because that can predispose them. So with this introduction, I just want you to know psychiatrists and mental health counselors can help abused children regain a sense of self-esteem, cope with feelings of guilt about this abuse, and begin the process of overcoming the trauma. Cognitive behavioral therapies for children and parents can help them to deal with the consequences of sexual abuse. Also, if you suspect or have any concerns, you can use a 24-hour hotline child abuse hotline called 1-800-422-4453, or you can always call 911 if necessary. Thank you again, and congratulations to Ms. Cass Gowrie on this wonderful new book.